Had a 58-year-old patient come in. His name's Mike. He got T-boned. I mean, he hit from the left side of his car. And he had a lot of pain in his neck. Some low back pain as well, but his main complaint was radiant pain from the neck into the shoulder and into the right arm. Well, the first thing we did is, of course, we examined him, and we x-rayed him, and we did a thermograph on him, which helps us to understand more about where the focus of inflammation is. As you can see here, over on the left-hand side, you can see he's got some arthritis in here, some degenerative joint disease is what the actual term is. That complicates the situation a little bit because it's not as sturdy perhaps as it once was because of the degeneration. I think the illustration of this is very interesting. He had pain in the neck, pain in the shoulder, couldn't sleep at night, and numbness in his thumb and forefinger. I happen to be on the right side. And if you look closely here, this illustrates it pretty well. There's other things we look at, but if you look at this little wedge right here, and you look at this little bony knob coming up, it's offset to the left. It's not in the center. That's a little hint of a problem there. The problem is inflammation, swelling. He got hit there. He had an automobile accident. And it's swelling and inflamed. And that inflammation of the soft tissue, that swelling of the soft tissue is what's causing this to look like that. It also aggravates all of this stuff over here you see on the left. Now, the next step that we typically do here at the clinic is we do what we call a thermograph. Here's the thermograph for that particular patient, and you can see here the different colors, the color variations. Red, as you can imagine, is the hottest. That's 2 degrees. Orange is about 1 degree. Yellow is about a half a degree. Green is something underneath that. And you're looking at, look at the temperature here around this area and around the degenerative area that we're talking about here. It's all pretty inflamed through there. The entire cervical spine, actually. Additionally, he's spiking some high temperatures right here at the top of the thoracic spine. Fairly typical. It's really difficult not to hurt this part of the spine here when you got a 25-pound head that's being connected by your neck and you're moving in an accident and you get that hyperflexion, hyperextension, or side-to-side trauma. It's very often you see this here, this injury to the thoracic spine. But this is a very good illustration of what an injury to the neck can generate and how it looks on a diagnosis area. Treatment plan for this is very interesting. The idea here is to lower the inflammation, lower the swelling. I'll see the patients like this anywhere from 2 to 4 times in a row really quickly. Why? You want to be aggressive in getting the inflammation down, aggressive in getting motion back into the injured areas. Then after that, it wanes down. You see patients less and less. The idea is to go through, get them through what we call the pain phase. Pain phases can last anywhere 1 to 10 visits, so to speak. Then you get into the corrective phase, getting it down so it's bringing it back to a normal configuration. And that generally takes twice as long as the pain phase. Nobody's the same. There's no cookbook here. It's how everybody's different. Everybody's reaction to inflammation, their immune systems. I guess we all understand what that is these days. The immune systems all work differently. But this is an illustration of one patient that we see here at the Automobile Accident Injury Clinic here at West Coast Spine Center. If anybody you know has had a car accident, a boating accident, do them a favor, do yourself a favor. Pick up a phone, dial 941-362-2000. Come see us at the Automobile Accident Injury Clinic at West Coast Spine Center. We've got your back.